Good afternoon, and welcome to the public briefing from Calcasieu Parish COVID-19 response. My name is Brian Beam, Calcasieu Parish Administrator, and we're going to have some of the same speakers today, but we also have some new information. I'd like to start. I want to recognize our sign interpreter today, Mr. Chuck Falcon. We appreciate him being here today. Very helpful service. We're going to start off, as we normally do, with the Emergency Preparedness Director, Mr. Dick Grimion.
Thank you, Brian. I'd like to just point out it takes a little while for the speakers to get up here. We have everyone spread out about 20 feet apart here in the building. I'd like to start today with the testing operation that we have out at the Burton Complex. On Tuesday, we saw a total of 63 cars. 10 of those were not qualified, and we tested 64 people that day. Yesterday, we had 35 cars. No one was turned away, and we tested 40 people. Today, so far, we've had 18 cars, and we have tested 21 people. Those numbers are lower than what we expected. We're not really sure what that means, but there are additional testing facilities around the parish and around the region. So hopefully the people are getting tested just in different locations. But we would like to remind people, next week we'll be running the testing station again. It will be from 9 a.m. to 3 p.m. on the same days, Tuesday, Wednesday, and Thursday of next week. We'll announce from week to week the availability of the testing and location. Preparedness notes, and I'm sure the other speakers are going to cover this also, but remember to wash your hands. That is one of our best defenses against COVID. Wash your hands. If you have to cough or sneeze into your elbow area. And last but not least, what we're practicing here today is social distancing. Put at least 6 feet apart from other people. If you can avoid going out to places where there are a large group of people, do so. Staying home is really the safest thing to do. So with that, I'll turn it back over to you, Brian.
All right, thank you, Dick. Before I introduce Dr. Cavanaugh to speak, just a reminder, we are currently located downtown Lake Charles in the Emergency Operations Center. But we also recognize a lot of the viewers are not just from Calcasieu Parish, from the 5-parish area, and Dr. Cavanaugh, for example, is with the Department of Health, the Office of Public Health, which is a state agency, and she represents Region 5. So all of the area that they represent and that she's talking on behalf of, they cover. So it's not just Calcasieu Parish, and so everything she's covering is very helpful for all of Region 5. So at this time, I'd like remotely to have Dr. Lacey Cavanaugh give her latest report.
Hey, thank you. Good afternoon, everybody. Thanks for that explanation, because I do find it gets confusing sometimes. Like to just first thing, touch base with the latest numbers. And the good news is that they seem to be somewhat encouraging. You know, when we look back a week ago and where we were a week ago and where we thought we would be today, we are in a better place than what we expected, which is a good problem to have. But the concern with that is that it's not yet as bad as what was predicted. So we don't want people to get a false sense of security or a sense of complacency that makes us feel that this event is ending. We're still at the very beginning of this event, and we still have a long way to go before the threat is gone. And so we have to continue social distancing for now. If we decide to go back to where we were before this event started, we are very rapidly going to find ourselves in a situation that our hospitals are overwhelmed. So the good news is that we are seeing signs that these measures are working, but the bad news is that that makes people feel very comfortable, which we don't want right now. So definitely we have to keep up the good work that we are doing with social distancing. We know it's not perfect. We know that it is extremely difficult. On a personal level, it's been even difficult for myself and my children. But we have to do this as a community because we know that we are actively saving lives right now by doing it. So the state numbers, the latest report as of today, we have a little over 18,000 confirmed cases across the state. We have 702 deaths, almost 87,000 tests that have been run across the state of Louisiana. So definitely that is a testament to how much testing capability has ramped up. We also have about 2,000 people hospitalized, and a little under 500 of those, 473 to be exact, that were reported to be on ventilators. You notice that number has actually gone down over the past couple of days, and that's also good and bad news. The bad news is that some of those cases have actually passed away, and the good news is that we are also, as we learn more about this disease, learning ways to keep people who are sick from ever being on a ventilator, and new methods of treatment that are allowing fewer infected folks to end up severe. And so sort of good and bad news, and that number has gone down for both of those reasons. So Calcasieu, 209 cases as of noon today with 4 deaths, and we have run across Calcasieu Parish about 4,000 tests since the beginning of this. Allen is at 66 cases with 5 deaths, Beauregard at 26 cases with 1 death, Jeff Davis, 30 cases with 2 deaths, and Cameron has now been identified as having their first case, although we are aware that some of those folks who may live in Cameron but have a Lake Charles address, there's been challenges with the parish of residents and collecting that data. And so we know that there probably are many more in Cameron. And we know that those are just probably a fraction of the cases that are out there. The delays in getting testing results back have improved since even last week, but it does still take time, and it is still reflective of what we were seeing in the community a week ago or a week and a half ago versus the active number of cases that we have now. So we definitely are continuing to watch and trend these, but some encouraging signs. We have to keep it up if we want those efforts to be worthwhile. More information is also continuing to come out about characterizing the people who are at highest risk of dying. And as we talked about last week, diabetes was sort of leading the pack, but new data that has come in this week says that 66% of people who have died from COVID within Louisiana had an underlying history of hypertension. 43% had an underlying history of diabetes, 25% chronic kidney disease, 24% obesity, 22% cardiac disease. So by far, most of the people who had severe complications and have died of COVID have had an underlying medical condition. But we also have to realize that those numbers are not adjusting for how common these diseases are within the population. So there's a high percentage of people within Louisiana who have high blood pressure or have diabetes or have obesity. So we don't really have the prevalence of the disease built into numbers, at least not yet. So for example, for obesity, when we look at 24% of the people who died had that as a risk factor, that is close to how many percentage of our population has obesity to begin with. Whether or not we're really going to eventually pull that out as a higher risk of death is sort of still to be determined. So by far, though, most of the people who have died have had underlying conditions. And we know from other diseases that if those conditions are relatively well controlled at baseline, that probably reduces the risk. How much? We still don't know. We don't have clinical trials yet that say if your hypertension is well controlled, that means that you're at less risk compared to somebody who has hypertension that's not well controlled. But based on what we know about other diseases, if chronic stuff is well controlled, that usually is a good thing in terms of your risk of complications. The other piece of information that really came out over the past week is we started releasing information about the demographics of the deaths, including race. And as we have seen, we have a majority of the people in Louisiana who died of COVID have been African American. And to many people, this has been very surprising. But I'll tell you, to me, it has not actually been surprising at all. Health disparities and worse health outcomes in the African American population or other underserved populations is a well-known thing that happens in many other diseases. So those disparities were there before COVID ever came around. And now COVID is shining a light on what I have seen within the medical community for years. The question is always going to be why? Why are they having a higher chance of severe complications? And so far, we don't have a clear-cut answer because, once again, this particular disease is new. But I can tell you that with other diseases, when we look at it, it definitely goes back to something that we call the social determinants of health. So there are differences in education, in income, in transportation access, in access to care. There are a whole lot of things in our social world that then eventually impact our health. And I think that as we learn more about why this disparity exists for COVID, I think that we will get more information about it as time goes on. But I suspect that it's similar to what we see in many other health outcomes. So we don't have regional level data available for that yet. We think that will eventually be released. Right now, our numbers of deaths are still low enough that we don't have a statistically accurate picture of what that's going to look like here in Region 5 yet, but I do think that information is going to be coming. And there's a whole lot of different reasons. Like I said, I mean, social determinants are one, but we also have to look at the underlying baseline health, and then we also have to look at exposure bias and testing bias. So are certain communities more at risk because they work in jobs that are considered critical infrastructure, and they don't have the option to telework from home. So we don't know the answer to that yet. We haven't been able to collect that data because, once again, this is new information that is coming out. But I do expect that we are going to be exploring all of those possibilities and working on some targeted efforts to try to improve outcomes within our African American community. So I wanted to talk about that. Also wanted to talk about underlying health conditions. And so people, I think, in the community have been afraid to seek medical care for things that you absolutely need to seek medical care for. So I know it is scary to think about going to an emergency room right now, and we certainly don't want anyone who doesn't need to be in the room to be going right now, especially in the midst of this pandemic. But for people who have emergency level conditions, who have severe chest pain, who have abdominal pain, who have symptoms that could be compatible with a stroke, we don't want people who are having severe things to not feel safe going to our ERs, because our ERs have put a whole lot of measures in place to protect people who are coming in for non-COVID related things. They are definitely doing their best to isolate people who could have COVID, to sanitize properly. And if at the end of the day, people are at home dying of other chronic conditions because they're scared to go to the ER whenever they need to, then we've defeated the purpose. And so I just want to encourage people who are in need of emergency level care to make sure that they are still seeking the care that they need. And for those who don't need emergency level care, exploring options like telehealth and calling your provider, because there are still a lot of services available. Our entire model of how healthcare is delivered is actually shifting due to this pandemic, and telehealth is a lot more prevalent even than it was 3 weeks ago. And so I think there are a lot of options for people in our community, and I want them to continue to seek care for things that require care. Another thing is testing. You've probably heard a lot in the media this week about new tests that are coming online. There are some rapid 45-minute tests that have been developed and are now starting to become available. There are rapid 15-minute PCR tests. So these are tests that actually isolate the virus's RNA, and they're becoming more available. The turnaround times for our send-off reference lab testing have gone down from 7 to 10 days when we started this, down to 3 to 4 days in a lot of cases. So we definitely see the testing supply chain getting better. And now we're also starting to see new types of tests called antibody tests coming. And those are tests that can detect your immune system's response to this virus. And so at some point, as those come online, we will actually be able to get a better idea of who all in the population has had COVID and potentially what kind of immunity we have. So I think that it's all very interesting. It shows how fast information is coming out and changing. I get updates pretty much on an hourly basis of all of the new things that the medical community is doing. Still very preliminary information coming out about drug treatments, about azithromycin and some of the antivirals, and you probably heard a lot about hydroxychloroquine this week on the national news. And the thing is that some of our hospitals, even here within Louisiana, are enrolled in clinical trials now that are testing the safety and how well these drugs work. And so we are excited that there seems to be some promising preliminary data. Of course, none of it is really truly tested and vetted yet, but that's coming. And so we look forward to the day when we have that could help us to treat this disease. So more information, and it's rapidly changing. I'd like to also just touch briefly on the recommendation that came out since our last conversation about masks. CDC came out and has now said that they are recommending people who have to be out in the community, you have to go to the grocery store, to wear a homemade mask if you are able to. And so the reason behind that recommendation is because we have found that there are a portion of people in our community who actually have the virus who are asymptomatic, meaning they have no symptoms of disease. They don't even know that they have it, and they could potentially spread it to other people. We don't think this is the primary way the virus is spreading, but we do think it is contributing at least to some degree. And so the homemade mask recommendation is not to protect you from getting the virus from anybody else. It is to protect you from being an asymptomatic carrier of the virus and spreading it to other people. So this week, the Surgeon General of the United States did a Facebook or an online video that you can view that shows you how to put together and make a homemade mask out of a t-shirt. Lots of people are taking to that recommendation. It is just that. It is a recommendation. It is not a requirement. And not everybody has access to be able to get a mask. We definitely also want to make the point that these are homemade masks and not surgical masks or N95 masks that our medical community still definitely need to take care of positive COVID patients in our hospitals. So I would definitely encourage people to check the CDC website. The LDA website also has a little tutorial about masks. We also want to make sure that if people are choosing to use the mask, that they make sure that they put it on and take it off right, that they are washing their hands anytime they touch it, because it defeats the purpose if you put on a mask and then you take that mask off and then don't wash your hands, touch a bunch of stuff. And then also that we're sanitizing masks properly, and that we're not just putting it on and letting it sit on the counter and putting it right back on an hour later and letting it sit on the counter. I mean, we have to clean them, right? Or else potentially these things could do more harm than good if we're not sanitary about it. And so I do think that if you're able to, and you don't have any other reason that you can't wear a mask, it's considered recommended by the CDC now. But at the same time, we understand that it's not always possible. Some people have conditions that they're short of breath at baseline, and maybe that mask is going to make it difficult for them to breathe. Or in young children, these sorts of homemade masks should never be used in who are under the age of 2 because it could potentially obstruct their airway. And so there are definitely limitations to that. And there's also not a lot of data that says how much this reduces risk. And so there is still a lot unknown. Last point that I wanted to make is that as this disease progresses within our community, people do recover. Lots of people recover from this. And so what I don't want to see is I don't want people who meet the clinical definition of recovered, who have been at least 7 days since the symptoms started, and they are feeling well, and it's been 3 days since they had any symptoms at all, or even longer than that in some cases, and they are recovered by definition, and they go back out into the community, and they are made to feel like they are unwelcome in the community, because people think that they're still infectious. And so people are going to get this virus, and people are going to recover from this virus. And we need to follow social distancing at all times for everybody. But at the same time, we don't need to stigmatize those people who are recovered. If anything, they need our support, because it's definitely a challenging disease and a scary disease. And so we need to be supportive of our community members who are doing better and who are considered recovered. So reminder that 211 has lots of information. The FAQs are updated on pretty much a daily basis with information as it comes out. And that's all I have today. Thanks, and I'm willing to take questions.
You were one, people who are very sick last year in January tested negative for the flu and they actually have had COVID. That's a lot of people asking about that.
I'm going to need somebody to repeat the question. I'm having trouble hearing it.
I'll repeat it, Dr. Cavanaugh. The question is, if somebody had the flu late last year, what they thought was the flu, and tested negative for the flu, could they have had the COVID virus instead, is the question. You want me to repeat that?
I think I got it. In January, it was probably very unlikely that was actually COVID, because we know that back in January, although there were probably some unexplained viral illnesses, that happens every winter. There are many viruses out in the community on an every basis, even some that are not the novel coronavirus, that are the coronavirus that we've seen that causes the common colds for many years. There are lots of other viruses that can cause people to get ill and have these sorts of respiratory symptoms. And so chances are it was not the coronavirus. If you got sick in January, tested negative for the flu, chances are it's one of the other seasonal viruses that goes around every year. Now, if you had an unidentified illness kind of closer to the end of February or early March that was undiagnosed, then it was more of a possibility, because we know that following the science and the way that this virus has rolled out across the community and looking at the curves and the modeling data, we know that there probably were some cases of transmission at the end of February and early March before we really knew that it was in our community. But back to January, it's very unlikely.
A viewer wants to know why businesses are not required to provide masks, gloves, and hand cleaner, germ cleaner for employees required to work.
The question is, why aren't employers of essential businesses, I assume, required to provide their employees with appropriate gear such as gloves, masks, and hand sanitizers? I'm not sure if that's a question for you. I know you promote that, Dr. Cavanaugh. I don't know that, maybe you can answer that as far as that goes.
So I don't know that I can answer why it's not required. I can say that in general, those things like having hand sanitizer available are good practice. What I've been recommending is that people visit the CDC guidance for businesses and use that as a guide. Every particular business is a little bit different, and what's feasible at one may not be feasible for another. And so I'm definitely not the regulator of those sorts of things, but I think in general, businesses should be looking at their situation and doing whatever it is that they can, that's in their scope and their practice to try to protect people, because we all need to take this threat seriously.
Any numbers on how many nursing homes are infected and how many residents of nursing homes are infected?
The question, Dr. Cavanaugh, is there any numbers on how many nursing homes here have had positive tests, and further, how many residents of those nursing homes? I do remember last week, I think you said, Dr. Cavanaugh, that the information on how it's reported as far as locations and actual names of nursing homes, I don't know that they go that far. I'll let her answer that.
Right. So I will say that our office, Office of Public Health, is in touch with any nursing homes or other high-risk facilities that have known cases on a very regular basis to get updated. The actual number within the region is not something that is being publicly released at this time. I can tell you that we got quite a few, but we're not releasing facility level information in terms of like a list of nursing homes that have a positive case. One is that, I mean, that information is changing very rapidly. And two is, at the end of the day, we should be treating every single person as if they could potentially be infectious. And so it shouldn't really change our actions as a community, whether or not a particular facility has a case. I'll tell you that we are definitely staying on top of that to make sure that facilities that have cases are listening and practicing good hygiene, good practices. And we're staying in very close contact and providing them with frequent guidance.
Thank you.
Thank you. Any other questions at this point for Dr. Cavanaugh? If not, we'll go to our next speaker. We're going to hear from a couple of our elected officials. Our first is President Tony Guillory from the Calcasieu Parish Police Jury.
Thank you, Brian. Just want to start off with a little short prayer. Dear God, we come to you today with trust and hope. In this time of need, bring wisdom and strength to the doctors and caregivers. Bring healing to those who are ill. Give comfort to those who have lost loved ones. In Jesus' name, amen. I just want to say, I remain hopeful during these hard times, but everyone must do their part. We want people to get good information from good sources about the COVID-19. There are many ways to do this. If you have any questions, please contact the 911 network by dialing 911. You can text LACOVID to 67283 to get updates and the advice about the COVID-19. Sign up for Calcasieu, CALCASHOUT, to get the latest information at www.calcasieu.com. My prayers are with all of you. And as always, stay home, stay safe, save lives.
Thank you, President Guillory. I know we've heard some comments. Occasionally we accidentally forget and we touch the podium, so we want to clean it. I apologize if we do it. It's an honest mistake. Let me clarify something Mr. Guillory said. He used 911. If you have a true emergency, obviously call 911. For special questions, though, any questions on COVID-19, please call 211. We actually have Denise Durrell here, who's going to come up in a few minutes, talk a little bit more about that. But our next speaker right now is Mayor Nick Hunter from Lake Charles.
Thank you, Brian. Good afternoon, everyone. While we certainly are seeing some glimmers of hope on a local basis and on a national level, I want to encourage everyone not to use these glimmers of hope as an excuse or a reason for us to go back to business as usual. In fact, quite the contrary, I believe that we're seeing some positive stories here because of the steps that we have taken. I believe that social distancing is working, and we've got to keep that up. And by the way, that's not just Nick Hunter, the mayor, saying that. That's medical experts. And I've said it a dozen times. I'll probably say it another dozen times. I don't know, in a situation like this where we have a medical emergency, why we wouldn't adhere to the advice of medical experts at this time. One death, one sickness is too many for Lake Charles and Southwest Louisiana. I also encourage people to realize that those numbers of deaths represent people in this community, people with families and people with friends. And there's a lot of people that are hurting in this community right now because of that situation. I again want to say happy Easter to everybody. We can absolutely have a happy Easter and honor the resurrection of Jesus Christ without congregating in large groups and without some of the camaraderie that we normally have during normal times. And I want us to remember that if we truly want to love our friends and our family during this time of Easter, it is best to show them that love by social distancing and staying home. Thank you.
are you concerned people are still congregating in large groups? I haven't been out too much, but we are getting a few, people raising concerns that parking lots are full and stuff like that.
Whether we see it or not, we're going to continue to hammer that point home, that people need to stay home and social distance. That is an encouragement of the medical community, law enforcement, and local, state, and federal elected officials.
Has anyone been ticketed or anything like that for violating the stay-at-home order?
I don't know about ticketed, but I can tell you absolutely that law enforcement has intervened when they're seeing groups congregate against the decree of the governor, and we've taken steps to ask those people to disperse.
Curfew?
No curfew yet. I'll also, I don't know if law enforcement's on the agenda, but not from the city of Lake Charles' side. Thank you.
Thank you, Mayor. The next person to speaking of that, I know he'll answer that question, Chief Deputy Stitch Guillory from the Calcasieu Parish Sheriff's Office.
Thank you, Brian. Good afternoon. I touched it. I just want to say from the law enforcement side of business that, it's business as usual. The Cavanaugh Parish Jail is open. We're booking people in jail. We booked in 11 last night. If you go out there and you break the law and you get arrested, you will be booked in jail. It's in the line. I've talked to all of the chiefs within the parish. Nobody's experiencing any issues or any problems. But I do want to take the time to thank all the businesses that have instituted the social distancing recommendations. It's not only large corporations that are doing this, but also the local mom and pop businesses and small businesses that are very important to our area. So I'd like to say thank you for doing what you're doing to make our community safe and help keep our community safe. As Brian said earlier, alluded to, that there's a number of viewers that are not in Cavanaugh Parish. I can tell in Cavanaugh Parish we have no curfew. There is no curfew in Cavanaugh Parish, but there is one in Jeff Davis. Theirs is 9 p.m. to 5 a.m. and there's also one in the Maryville area. Theirs is let's see, I wrote it down here. Theirs is 10 p.m. to 6 a.m. Our parks are open. We're asking people, if you go to the park to exercise, please practice your social distance. I can tell you, if you're having a big crawfish boil at Pran Lake Park with a bunch of people, law enforcement's probably going to go out there and shut you down. Okay, we got to do our part. And the great thing about living in Cavanaugh is we all love our parish, and we've been through tough times in the past, and we've always stepped up and done what needed to be done to help our community. And this time it's going to be no different. I have faith in the people within our community that love and care about our community, that we're going to do what's right to make our community safe.
Do you think leaving the parks open sends the wrong signal to people?
The question was, do I think leaving the parks open sends the wrong signal? Teresa, people have been in their houses for a long time. It's been, 4 weeks now, or going on 4 weeks. Sometimes you just need to get out and get some fresh air. And we're saying that's okay. You can do that, but don't do it in large groups. And just remember to practice social distancing. We can do this in a safe manner. That's why the choice was made to leave the parks open, because we felt like, at the same time they could go out and get exercise and get some fresh air, but also be safe and keep our community safe.
Thank you.
Thank you.
Thank you, Stitch. That was a very good answer, I believe, on the parks. I know we've been asked that at the parish level. Let me put a little context to add to Stitch's comments, which, again, I think were very well spoken. You think about parks just in Calcasieu. The parish has parks. You have 6 municipalities. They each have parks. You have Sam Houston Jones State Park. You have 7 or 8 recreation districts are what are called community center and playground districts. They are there for the enjoyment of the people. And my answer to that, I'm just speaking for the parish, but I think it's been said quite well. Yes, we do. We have no regrets about keeping these open. As a matter of fact, Dr. Cavanaugh has even echoed these comments. This is a good thing for people to get out, as long as you obey those social distancing guidelines. And the bottom line is our elected officials and those working in the public trust the people to do that. The downsides of closing these are much worse, in our opinion, than leaving them open and trusting our people to follow good common sense guidelines. And when the very small few who don't follow that, if that occurs, law enforcement is there, and a lot of the city, parish, and rec district employees are there too to gently remind them. So I believe this is a positive thing if it's done right and with guidelines followed that are easy to obtain. So I just wanted to add to that.
A viewer wants to know why the police jury suspended ditch digging and mowing to battle the coronavirus.
The question is, why did the police jury suspend ditch digging and mowing because of the coronavirus? I'll speak to that one. We have suspended regular mowings along roads and ditch digging because there are legitimate concerns about the social distancing. Now, you might think, okay, one person on a boom mower along a road is not harmful. But that's not all that's there behind the scenes to have mowing, and we have 1,200 miles of roads outside of any city that we have to maintain the roads and the right-of-way, which means mowing. You have to have mechanics back in the shop. You have to refuel regularly, and that gets into violating it. What we have done already is start focusing on those areas where the grass height becomes a sightline issue. For example, at an intersection, you do need to be able, the person in the vehicle needs to be able to see across those intersections. So we're doing more of those. Each week we have focused more on that. We're looking at it again Monday. The weather's warmer, so as that happens, we are certainly looking at possibly ramping up. But there is still a reason, and to follow Dr. Cavanaugh's instructions a while ago, we're not out of the woods yet, even though there's glimmers of hope. But it is not because we don't know the grass is getting higher. Safety is first, and that's what's going to be our main criteria. But we will relook at this and, if necessary, ramp up beginning next week. Now, I know each of the cities isn't here today. They have their own procedures, but that's just speaking on parish roads.
Did you want me to finish the parish question?
Well, why don't we have only one more speaker. Why don't we wait till after that, and then we can come back to questions. We have Denise Durrell here, Director of United Way. They are the official sponsor, and they have the 211 system, which has been extremely helpful here, and I'd like to ask her to come up for a moment.
Thank you, Brian. We just want to remind the public that 211 is still available 24/7 to all of our local residents by simply calling that number 211 from any landline or cell phone. You can also text 211 at 898-211. And what you'll find on the other end of that text message or that phone call is an operator who's certified and accredited call specialist to help you navigate through the system, whether it's non-emergency questions that you have about COVID-19, or you may find yourself in a situation now economically that is different than where you were before this disease has affected our community. And that may be that you now find yourself that you might be food insecure because of reduced hours at work or that you're completely unemployed. But please call 211 because we've got information related to where the feeding sites are in our community, where our food pantries are, and when they're open. If you now find yourself unable to pay your rent or your mortgage or your utility, there may be agencies out there who are willing to assist you with that. If you need access to a mental health provider, you actually can call 211 and they will give you a warm transfer, so you will immediately be contacted and be able to speak to a mental health professional. If you need information about signing up for unemployment or any of the services out there, again, you can call 211. And we're finding that we find a lot of people now are wondering if they qualify for SNAP. And in fact, we've had over 41,000 people text 211 specifically with the keyword Get SNAP to figure out if they qualify for that or not. So any resource that you can about imagine that you may need, I think the first place that we would suggest that anybody call is start with 211 and let our community of resources and services and programs out there get to work for you today. So thank you very much.
We appreciate Denise being here. We certainly don't want to lose track. For some people, just basic sustenance is at stake, and there's so many needs out there. 211 is a great service for that, to connect those who can provide help. That is the end of our set of speakers today. So at this point, if there are any other questions, we'll take them at this time.
We have heard from people who say they can't get through the unemployment office, that maybe they've tried for 2 hours and never get through.
The question, I don't know why I'm repeating that. I keep thinking I'm talking to somebody remotely. The question about unemployment, the way this is set up, each of the parishes around the state have a workforce development group, the American Job Center. That happens to be under the police jury, parish government here. However, unemployment applications have to go through centralized state mechanisms, and it's a phone number. And so this is something the local parishes can't control. Once those things are in the system and the distribution of unemployment benefits comes through, that's where the local parishes get involved. The state is well aware of that, I'm told, and dealing with it as quick as they can, but it has been simply overwhelming the system. But we are required at every parish to have people use that phone number. We don't have that option. So that's something that the state has to work through, and I think it's still overwhelming them, but they have been working to solve that problem.
So is 2 hours typical, or do you have any idea?
I have heard that it's been multiple hours in some cases. Yes, I don't know that that's out of the ordinary right now, unfortunately.
A viewer wants to know if a landlord is required to defer or waive rent, and what if it's government housing?
I do know this is where, I don't know if it's state or federal, but I do believe there are eviction prohibitions right now in place as far as any landlord trying to maybe evict someone. I don't know if that's the question about payments. That one I'm unclear on. That might be one. I don't want to keep loading it down, but if that's something they can call 211, I think they can probably get a more specific answer depending on their situation.
Okay, and is there any provision for essential employees getting extra pay?
Question is there's any provision for essential employees getting extra pay. Every company, every organization has to handle their own pay rules accordance with their own policies and accordance with the federal laws. Some of those they're looking at right now changing, so it literally changes almost every day. I know, speaking at the parish, and I believe the other public entities represented here, if you're working as an essential employee, I know in our case, I'll just speak for the parish, we pay those overtime. So yes, you get extra for that if you are deemed essential, but that's an internal decision by us, and I think I would be less comfortable trying to answer that for others, but I know that is in our case.
And finally, some people are having difficulty distinguishing between price gouging and prices just going up due to demand. How do you tell?
Question has to do with prices. How do you distinguish between just high demand causing prices to go up and price gouging? I don't really have an official answer for that. I know the Attorney General's office is dealing with this at this point at the state level, and they are going, of course, more after price gouging. I don't know that I have a magic way to distinguish. I think if the person who is encountering what they think is price gouging, I would encourage them to call 211, or we'll let Chief Deputy Guillory, if you want to take a shot at that. Or
we have a partnership with the and the Attorney General's office. If somebody thinks that there's price gouging going on, they can call our office. We'll go out and make a report and forward it to the AG's office, and they'll look into it.
Have you found any price gouging in Calcasieu Parish?
Not that we're aware of.
Okay, just to repeat, thank you, Stitch. You can actually call the local sheriff's office here in Calcasieu if you believe there's a case of price gouging. They have a partnership with the Attorney General's office at the state to coordinate any response to that. When asked, do we know of any locally? At this time, we do not. At the sheriff's office. Thank you, Stitch. Any other questions? Anyone else? Okay, the public briefings, we are scheduling these each Thursday at 2 p.m. so we can have something people know is coming. Unless something comes up prior to that, the next public briefing will be Thursday, 2 p.m., which will be April the 16th, I guess. We appreciate everybody coming and watching.